Many thanks for staying with us. We're still live on the 12 report, and we talked about the health crisis before going on break. We have News Central's Aishat Salihu, who's been monitoring the situation and is currently on standby to give us more updates. Aisha, how much concern should the recent report released by the NCDC be for keen observers and even for Nigerians in general?
So my blessings. Well, as you know, Lassa Fever is a an acute viral hemorrhagic illness that is transmitted from animal to human and also human to human, with symptoms presenting as, fever, general weakness, headache, and then more progressive symptoms as sore throat, muscle pain, chest pain, nausea, vomiting, diarrhea, facial swelling, bleeding from the nose, gums, GI tract, shock, seizures, hearing loss, amongst others. These are just to mention but a few. But now the NCDC is saying that the fatality case rate as of last year to this year, the week in focus has increased. And this is even more concerning. I would say that because owing to the fact that this period where one would say this is the wet season, because experts have said that Lassa fever is more prevalent in the dry season, where you have people, especially people in the rural communities, come out to spread their grains and food items, perhaps on the roadside where they can come in contact with excreta from rodents. But then it is more concerning now that we have the fatality case rate higher this year compared to last year. And then from people that we've heard from, especially in the FCT, I would say awareness is not that much, because the fatality that we're talking about and the confirmed cases is not really much in the FCT. It's more in Ondo, Bauchi, Edo, and those other states, and that is where there is more confirmed cases. But for FCT here, the awareness is not that much. But then for prevalence and also surveillance, the NCDC and also measures that people can take, NCDC is calling on people to be more careful about their interaction with animals, especially rodents, excreta from rodents. Measures to put in consideration would be that they should avoid contact with rats and their droppings, and store food in rodent-proof containers, improve sanitation and hygiene, isolate infected patients, and also report these cases when you see symptoms that I mentioned earlier coming up about this disease. But then, so it's a bit more concerning this year, because the fatality case rate has increased as compared to last year.
All right, Aisha, thank you so much for the updates. It's quite a concerning update, and we're hoping that more awareness is given, especially to the people, not just those who are keen on the story, but every citizen deserves to know what's happening with the spread of Lassa fever. Thank you for the update.